What's cracking, guys? Nick here from What Health. I'm just going to show you some little ways in which you can effectively mobilize yourself at home, particularly in the mid-back, the thoracic spine, which is a huge pain producer in a lot of individuals who sit at desks all day, lift weights with heavy weights on their shoulder if they're not allowing core activation when that's happening, so they're passively got a weight on their back. You get a lot of what's called hyperkyphosis, which is an increasing curve through the mid-back, where you see a lot of people walking around like this with their forward hunched shoulders, really rounded mid-spine. I want to show you some ways you can kind of conquer that in order to increase what's called thoracic extension. There are a number of ways in which we test as chiropractors thoracic extension. One of them is called the wall angel test, which there'll be a clip of in this video. It's a way of showing us how much of that movement you can do between here and back here. There's a really nice couple of ways you can do that involving a foam roller. There's a couple of ways in which you can do that involving without a foam roller. This foam roller is from Amazon. It's by a brand called Core Balance. You probably can't see that there. Core Balance. It's one of the cheaper ones that I've managed to find. It's 90 centimeters long, which is a good length for a foam roller. You don't want something that's too short unless you're working on your IT bands down here, or your thighs, or even your hamstrings. They're really good for those, the smaller ones, but the longer ones, sort of the 90 centimeter ones like this, are really good for the thoracic spine, particularly if you've got broad shoulders, or if you're quite tall, if you're doing the lengthways one up the spine. So I'm going to show you the lengthways one first, which is a good one to start with, because some people have got quite a lot of discomfort and marked stiffness through the mid-back. So it's often not best to start sort of throwing yourself over a foam roller to begin with. It can actually do more harm than good. Another rule for the foam roller is not to allow your neck to extend too much over the top of it. You have to keep your chin tucked in and keep the shoulders back slightly in order to stop this happening, because you can give yourself an injury in your facet joints of your neck. Similarly, when it's lengthways, make sure your head is actually on the foam roller. It's going to be, to begin with, it's going to be your sort of coccyx area on one end, or your lower sort of pelvis, and your head up the other. Okay, so we're going to go lengthways like this. And I plonk myself on the end here, right on the end for me. I'm about 6 foot tall, so if you're a bit taller than that, you may want to get a slightly taller, slightly bigger foam roller. Lie with the foam roller lengthways up the spine. Your head should be right at the other end. Okay, you're going to keep the rib cage tucked in as best you can. Feet firmly on the ground, nice and controlled. If that's not, it's important to keep them sort of shoulder width apart, otherwise you end up sort of teetering side to side, which kind of defies the point of the exercise. You're going to bring your arms out, bring yourself over a little bit. You're going to bring your arms out to the side, as if you're about to do a snow angel. I've got quite good thoracic extension, so you may not get this far down to here. A lot of people only get to here because of tight pecs as well, which I'll show you where you can stretch those out. So if we're here, I'm pretty much touching the ground here, a lot of you won't be. If you imagine doing like a snow angel whilst keeping your ribs tucked in to the foam roller, keeping yourself nice and balanced on it, and you're just going to go all the way down, keeping that controlled. All the way down, and we're going to go all the way up, keeping those ribs tucked in, just slowly upwards. We're going to do 10 cycles of this, normal breath cycles, maybe fit 3 or 4 breaths in, up and down. I feel a real stretch through my pec muscles here, so in between my sort of sternum and my shoulder, which is really nice. Now I can feel it in the mid-back, because I'm trying to keep that tucked in, which is quite hard. And you go down again, and you repeat that 6 times. As you see, I'm scraping the floor here. A lot of you will not be able to do this. My thoracic extension is very good, where I'm slightly hypermobile through my mid-thoracic spine. Very bendy, basically. And all the way down. Keeping that tucked in, normal breath cycles. You get the gist. 6 times up and down, keeping that really nice and tight. Next one, if you can tolerate. This one's, I would suggest if you're getting sort of a acute mid-thoracic pain, which is bothering you day and night, especially on rest. If it gets really stiff first thing in the morning for longer than around an hour, I would suggest seeking the advice of a professional, and also potentially getting further investigations done for other sort of underlying disorders. But if this is just a pure tightness in the mid-back and you feel like you want to try and improve your posture, then this is a perfect exercise for you. Another rule for this is not to allow it to slip into the low back, purely because your low back is actually already into what's called a lordotic position, which means it goes, the curve is actually forward into your, towards your belly button. So if you hyperextend that, you can actually cause an increase in extension in the back, which can result in injuries. So your facet joints of your low back can become injured and inflamed, which can give you an increase in low back pain. That can be quite dangerous. So you don't want to go lower than this kind of area, lower ribs. Anything down here is a bit of a no-go for this type of exercise on the foam roller. So what we're going to be doing is you're going to be up into the glute bridge position, give yourself a bit of a hug, keeping that chin locked in, as I said to you before, not allowing that head to drop back. And you're just going to let the back drop, and you might hear some clicks and pops as you do that, and just extending gently over. You can hold for a few seconds. Some people like to do a little bit of side-to-side action as well, which helps some of the ribs out. And what we're going to do, once you've done a sort of 10-15 seconds on one area of just trying to get that extension over, we're going to roll up a little bit. And we'll allow some more drop. You can sort of scoop yourself a little bit if you want to, drop the arms in, pull upwards, and again we'll go a little bit more. I don't want to go any real further than this. Some people do like to actually physically roll up and down. I prefer just to allow the back to extend gently. Otherwise, that sort of rolling, that's going to get the muscles. Yeah, brilliant. You know, you can really ease off some of that muscle tension in between those shoulder blades and down to what's called the TL area. So into your lumbar erectors. Or thoracolumbar erectors. You don't want to go into too far into the lumbar erectors. If you do go into lumbar erectors, you're going to make sure you come up and forward like this. Tuck that stomach in, because you don't want that extension to happen, because that can be quite dangerous. That is going to increase the inflammation in your low back joints. That is protecting your low back joints. So it's up and down. Some real nice little areas you can get in here for the muscles. Sort of roll through, keeping that tucked in that sort of mid to low back there. But in the upper back, you can sort of drop back like this, okay? A couple other little things for the upper thoracic spine. So that's this section here between the lower neck and about here in between the shoulder blades. A real nice one called the Sphinx exercise that I like to do, the T4 Sphinx. Essentially, it's a cat-camel exercise, which is this one in the low back, which you may have seen in the previous video. In my 6-minute a day low back strengthening and mobilisation tutorial. Then we've got the T4 Sphinx, which you essentially, the difference is between that and the cat-camel is you're sitting back on your heels. What that does is that sort of mobilises the lumbar spine so it doesn't get involved, and it's purely going to be this area here that we're working on. Hands just in front of the knees, which is really important. Out here, you're going to get more lower thoracic spine mobilisation, which of course you can do if you wanted to. This is more for upper. So hands just in front of the knees, and then slightly externally rotated shoulders. So you drop the shoulders back and down. You can tuck the chin inwards. What we're going to do from here is we're going to do 10 repetitions of up, tuck that chin in, one breath cycle, which is about 5 seconds. And as you breathe out, look up to the ceiling. Let that just drop in. Let those shoulder blades kind of sag slightly. And when you go up, and then go down. And then you go up. Get a nice stretch of those shoulder blades. Let the shoulder blades wrap all the way around your rib cage. And down. And up. And down. 10 repetitions. And up. And down. Real nice mobiliser through the mid-thoracic spine there. Another one that I like to do is I'm using a chair. Something relatively comfortable actually, something like a bench like that would be better when it dropped down to flat. But this will do for the purposes of this. Some people like to use a dowel. You can't with this chair like this, but you'll see what I mean in a second. You're in a position here, you've got your elbows on, and you let that body sag through. And what you can do from here, make sure your triceps on it so it's not too bony in your elbow. You sag that downwards, and you're just mobilising the shoulders and the elbows like this, doing 10 repetitions. I suggest something a bit more comfy than this chair to get my funny bone a little bit. I'm just going to show you the movement. So something with a bit more padding is better. And we're just going through 10 cycles of this. And I really feel that through that section here. It's a real nice way of improving this movement through your mid back and just bringing those shoulders back and down a little bit. Real nice self-mobilising technique. Those 4 are really good. I mean, you can do those at home. 15 quid for one of these foam rollers. One of the best £15 you'll ever spend if you struggle with your posture. There's some other bits. There'll be a link to a video for the other stretches that are associated with helping out with that forward rolling posture at the desk. So feel free to take a look at that. If not, have a go at these, feedback to me, and obviously subscribe. Write in the comments how you get on with it. Cheers.